Thank you, Dr. White. The booklet that he was referring to is this program that you should have received when you walked in. And as I said, I'm going to be brief in the introductions, but all of the bios for all of the presenters are in this program, so feel free to look in there. A lot of the presentations are in there as well. Our next presenters on respiratory and airway health are Bill Kasner, thoroughbred owner and breeder. Many of you are familiar with. He founded with Kenny Trout Windstar Farm and bred and or raced horses that you definitely know, Funny Side, Deterra, Super Saver, Drosselmeyer. With him is Dr. Susan Holcombe, Michigan State University professor, large animal clinic sciences. Her research interests include pulmonary health and inflammatory disorders. Please welcome them.
Good morning. I'm going to start today, and then Mr. Kasner will finish our presentation. We have a few objectives that we would like to cover while we talk about pulmonary health. First is to convince you that lung function is imperative to certainly all mammals, but certainly the equine athlete. We're going to discuss the impact of lung disease on thoroughbred racehorse performance, and then the impact of the barn environment on lung health. And then finally, we're going to describe some strategies that will help you and combat that poor quality in air quality in the barn that will ultimately help horses. So why do we worry about the airways? It's kind of a simple question. The answer is somewhat simple as well. The airway is the conduit that allows the horse and all mammals to get oxygen from the air, then ultimately to skeletal muscle. Horses are tremendous aerobic athletes. And one of the reasons that they are tremendous aerobic athletes is they have a lot of mitochondria in their skeletal muscle. In fact, almost more mitochondria than any other mammal. And these mitochondria utilize oxygen to provide energy to the muscle. So the amount of oxygen that the horse consumes when it's exercising is certainly dependent on the effort that the horse is using, but it's also dependent on the delivery of oxygen to those muscles. And that's where appropriate pulmonary function comes in. So oxygen consumption, just to give you an idea of the elite nature of the horse as an aerobic athlete, the best human aerobic athlete is the Nordic skier. And when we measure oxygen consumption in Nordic skiers, they have an oxygen consumption about 80 mils per kilogram per minute. The horse has an oxygen consumption of over 2.5 times that amount. And that is what makes them tremendous athletes. So how does the oxygen get to the muscle? Certainly it's important that the upper airway is patent, but then the air moves into the lung through many, many tubes. Through those tubes, it is dispersed in the lung to little sacs that are called alveoli. And these air sacs, there are numerous air sacs within the lung. So many in the human lung, in fact, that if you took all the alveoli out of our lung and just spread them out, it would cover an entire football field. We don't exactly have that data for the horse, but probably would cover many, many football fields. So the surface of the area of the lung is set up to then move oxygen from this alveolus into the bloodstream. And then it's the job of certainly the heart and the components of the bloodstream to move that oxygen into the muscle. And then the reverse actually happens as well. Carbon dioxide is brought back to the lung, and then when the horse exhales, that product of metabolism, carbon dioxide, is voided. Horses are somewhat unique in that they are limited by their pulmonary function. So people and many other athletes are limited by how well their heart can pump the blood. In fact, horses are limited by the function of their lung. The heart in the horse actually pumps the blood during its most intense exercise, pumps the blood a little too fast for the lung to be perfectly effective. What that means is if we have any decrement in lung function, it's going to affect the horse's ability to supply oxygen to the muscles during the time when they would need it the most. So we're going to now move, we talked about the basic structure of the lung. We're going to look at one of these small lung sacs, the alveolus. And this is the place where gas exchange occurs. So the oxygen from the air moves into the alveolus. It crosses a very fine membrane of the alveolus and moves into the bloodstream. While that's happening, the carbon dioxide leaves the bloodstream and moves back into the alveolus. What's important is this matching of the blood flow and the alveolus, and also how thin the membrane is that allows these gases to exchange. When there's any damage to the lung, especially inflammatory damage, that gas exchange can be impaired. And that's a problem for a racehorse. So here's something for you to think about. How much does the horse increase its breathing capacity from when it's standing at rest to racing or exercising at maximum capacity? So we're going to answer that question. When a horse is standing in a field, grazing, or just standing in a stall, breathing at rest, breathes very slowly, about 12 breaths per minute. It inhales a small volume, which we call a tidal volume, that's about a gallon or 5 liters of air. So the horse is exchanging about 60 liters of gas per minute. When the horse is exercising at its most intense, and really a good representation of that most intense exercise is the thoroughbred racehorse, they increase their breathing rate by 10 times. So now they're breathing at 120 breaths per minute. And they triple the amount of air that they bring into their lung, or their tidal volume becomes 15 liters per minute. So the horse's respiratory capacity during intense exercise increases by almost 30 times, so that the horse is now moving almost 2,000 liters of gas per minute during intense exercise. That's a huge capacity for the lung of the horse. Now, as I mentioned, horses are unique. They are limited by their pulmonary function, not their cardiac function. And that's important because that means even small amounts of lung disease that will cause just a small decrement in their lung function can influence their performance when they're racing. This might not be something that's even noticeable at rest, but it certainly will affect them when they're trying to go as fast as they possibly can and they need all of their pulmonary function. A key component to respiratory disease in all mammals, but certainly horses, is inflammation. Inflammation does a couple of important things to the lung. We talked about these tubes that actually bring the gas into the lung for gas exchange. And during bouts of inflammation in the lung, those tubes become more narrow or they constrict. And these small sacs that we talked about, the alveoli that are so critical to gas exchange, they can become damaged. There can be extra fluid along those membranes so that the gases do not move back and forth into the bloodstream the way they should. And finally, a component of inflammation, 2 things. One is the mucus that the horse produces, and that is actually a sign that the horse has lung inflammation, and we use that as a marker of inflammation. There are also inflammatory cells that are brought into the airways to try to clean up what's ever causing the inflammation, but those cells and that inflammation can actually cause long-standing changes in the lung or fibrosis or scarring. So there will be some inciting factor that's going to cause this inflammation. The lung is exposed to this inciting factor. Then cells are brought into the lung that will cause a change in the lung, the inflammatory change. It signals production of mucus by special cells that are within the lung. And until that inciting factor is removed, this inflammation will continue. So what are these inciting factors? It can be many things: viruses, bacteria. What we're really here to talk about today are the environmental factors that can cause inflammation in the airway. And these are things like allergens, particulates, dust, toxins, heavy metals. basic pollutants. When horses and people breathe these things in, it will induce an inflammatory change in the lung. So not only does it cause inflammation within the lung, but that inflammation will also diminish the lung's immune responsiveness. And horses, like people, are then less able to fight viruses and bacterial infections. Inflammatory airway disease is a specific syndrome that's now been described as almost a subtle form of asthma that happens in horses. And it certainly happens in racehorses. In fact, probably over 33% of thoroughbred racehorses have inflammatory airway disease. It's somewhat subtle. These horses do not appear sick, they don't lose weight, they don't have fevers, they eat well. But their performance is affected. They may or may not cough, but we do know that they will have increased amounts of mucus and inflammatory cells in their airway during these bouts of inflammatory airway disease. We were very grateful to the Grayson Jockey Club Research Foundation. They funded a study that allowed us to look at the effects of inflammatory airway disease on performance in racehorses. And what we found is that statistically, horses that had no mucus or very trace amounts of mucus, which is labeled 1, those horses were twice as likely to place better in a race compared to horses that had more mucus. So marked 2, 3, and 4, increasing amounts of mucus. Shown here on this graph, same results, but horses with no to just trace amounts of mucus were more likely to win races statistically compared to horses that had moderate to severe amounts of mucus. So this did tell us that inflammatory airway disease was not only important to lung health, but it was important to horse performance. So what causes inflammatory airway disease? There was a consensus statement just published by the American College of Veterinary Internal Medicine that said inflammatory airway disease is caused by environmental conditions. It is caused by aerosolized particles and gases, so dust and pollution, as well as molds and fungi, endotoxin, which is a part of a bacteria that can incite a lot of inflammation anywhere in the body, but especially the lung, as well as inorganic dust. And those are going to be things like heavy metals and noxious gases, so other things that are part of pollution. So it's really the environmental conditions that are causing inflammatory airway diseases in horses. Is this something that just takes weeks or months to develop? The answer to that question is no. We know that when horses inhale dust, we will see changes in their lung and their lung function within 20 minutes. And those changes include things like increased number of inflammatory cells, as well as increased resistance in the airways. So the airways narrow, and they narrow in response to a substance called histamine, which is released during allergy, but also during inflammation, and it causes the airways to constrict. It also does stimulate mucus production. So this is something that can happen very quickly. So where is the dust? The dust is in the barn, and the horses are in the barn over 20 hours per day. This is also work that was funded by the Grayson Jockey Club Research Foundation. It's a little bit busy, showing you 3 different barns at a racetrack, barn 1, 2, and 3. And we looked at these barns during different times of the day, the morning, the afternoon, the evening, during different months of the year. And we looked at a couple different particle sizes within the barn and within each stall of the barn. The white stalls were very clean. They had very little particulate. The amber stalls, or the kind of yellow stalls, had enough particulate that as a person, OSHA would not allow us to work in those stalls. The red stalls were highly contaminated stalls. So what this work showed us is that not every barn is the same, and not every stall is the same. An obvious next question is, well, that's fine, some stalls are dusty, some are not. But is there an association between that dust and the amount of inflammation that we see in the horses? And the answer to that question was yes. The amount of tracheal mucus that we saw in horses' airways was associated with stables that had more dust, stalls that had more dust and particulate. We also saw more mucus in the tracheas of horses during months that had higher levels of particulate. So all of these things were associated. The highest particulate counts happened in the morning, and this is when stalls were being cleaned and horses were being fed. The barns that had the highest particulate count were enclosed barns, where there were only doors at the end of the barn or some windows, and those doors tended to be closed. The highest particulate counts were found in stalls where horses were fed from hay nets that actually hung outside the door, but when you watch horses, they grab the nets, they pull them in, and that disperses a lot of particles. Also, in barns where the aisles were raked continuously throughout the day, that would disperse a lot of dust, and that contributed to the highest particulate counts. So in summary, pulmonary health is essential. Small changes in lung function will have consequences for racehorses. Mucus matters. Horses with no tracheal mucus or trace amounts of tracheal mucus actually placed better in races compared to horses that had more moderate to severe amounts of mucus. So it's essential for horses to breathe clean air. Not only is that a health concern and probably a humane issue for horses, but it's very important for performance.